We're here today to lay out the coalition's position on parts of the proposed state budget and to announce our endorsement of 8 key bills. Now, the state of Texas faces a huge budget crisis. The people of Texas face a huge health crisis. We strongly encourage our senators and representatives to make healthy choices today that can both help them balance the budget and help Texans live longer, healthier, and more productive lives. Texas can no longer afford to indulge the smoking and eating habits of some at a huge cost to all Texas taxpayers. Tobacco is the leading cause of preventable death in Texas, period. Nearly 25,000 deaths each year in Texas are linked to tobacco. The direct and indirect cost of smoking in Texas is $20 billion a year. The draft state budget in both the House and Senate cut about $23 million in state and federal funds from tobacco control programs. This cut amounts to 4/5 of our very meager tobacco control budget. We oppose this cut as being penny-wise perhaps, but very pound-foolish.
The cost to the state for these bills is absolutely zero, but the savings are immense. A report that was released last week suggested that if we had an indoor smoking ban, it would save Texas legislators, Texas business, and individual Texans more than $400 million a year. Prohibiting indoor smoking will make a big difference in the number of heart attacks, in the number of asthma, premature births, and other diseases from which millions of Texans suffer. It would also make a huge difference in the state budget.
Obesity costs Texas businesses almost $10 billion, and that's projected to exceed $32 billion by 2030. Obesity is responsible for a 27% increase in health spending. More than 5 million Texans are obese, and that's expected to double over the next 20 years, meaning that by 2040, at least 75% of Texans will be overweight or obese. Increasingly, this crisis is beginning in childhood, and Texas is tied for 7th place among states in the share of its children that are obese. Despite all this, the draft state budgets are going the wrong way. They would cut $4.8 million. That's all state funding for obesity prevention programs. They would cut public school health programs by over 2/3, $65 million. Once again, we oppose these cuts as penny wise, but pound very foolish.